Hi, good afternoon. I'm Dr. Rajeev Gupta. I'm a consultant in the National Health Service in the United Kingdom, and I'm going to talk about what are the benefits of the modern medicine, and I'm also going to talk about the gaps in the modern medicine, what can be done in order to fill these gaps, and whether there is a method of bridging the gaps, and that too in evidence-based way, particularly using the complementary and alternative medicines. So I have been trained in the Western medicine or modern medicine for 30 years. However, over past 10, 12 years, I have found that there is significant gap, and these gaps are particularly for the chronic condition. It's fantastic for the acute conditions, but the modern medicine is not complete science for treating the chronic conditions because there are side effects, there are problems, and there are some difficulties. In addition, it's a cost burden for the patients, and the modern medicine with best will in the world still has got some to talk about how there are great advantages of the modern medicine. And as we move forward, we'll see how we can make it even better. Saying all that, I'm also the just declaration of interest. I'm chairman of the advisory board of the International Organization of Integrated Health Practitioners, which is integration mean modern medicine, alternative medicine, and the complementary medicine. So it includes a, a holistic approach that includes the Western medicine, but also yoga, Ayurveda, Tai Chi, Qigong, homeopathy, hypnotherapy, art therapy, music therapy, etc., etc. Because each of these have some role to play, and there are some proven benefits for a good proportion of this. And the evidence varies from small evidence to a strong evidence. So we'll see whether there is a scope to add and what are the advantages and disadvantages. Coming back to this, I would say that the integration of the traditional and modern healing approaches represent a growing healthcare trend. And this is for all developing countries because if you think of more higher level people, including whether it is the more literate people, the business people who are now more health conscious, and also those people who are like Bollywood star, Hollywood star, and many other people who are now conscious about their health. They do not want to pump their body with the pharmaceuticals, and they are going for more. And they keep coming asking me on a multiple occasions about can we do something natural or plant-based or yoga or in a way that is more close to the nature without needing to put pills in the body because pills are not the cure for everything. In UK alone, 4.2 billion pound is spent annually on the complementary medicine. And that is the purpose because people are using it. They're buying from shops. The Holland Barrett has in a good proportion of the shops sell these supplements, which is allowed within the United Kingdom. And I'm reasonably sure in many other countries, people buy it and use it without declaring it even to the health practitioners or their GP or the general practitioner or family practitioners or the doctor they go to. And we don't know how the interaction of these herbal supplements is happening with the modern medicine. There is some enzyme induction or some other side effects, which is because of the complementary effect or anti-complementary effect. It's good to be wise and know about it so that these many of these can work together for having a complementary or amplified effect with reduction in the dose. So that's something which is worth thinking about. I would suggest we need to be open-minded whether it is not, and we'll have a little bit of analysis a little bit later. 60% of UK population is using at least one alternative treatment, and the scientific evaluation of the combined therapeutic potential therefore become essential, necessary, or imperative in order to bring the best effect to the patient at the most cost-effective way and the least side effects. So let's move to the next part. Let's think of the medical landscape. And we know that the modern medicine is built on the evidence-based approach or evidence-based foundation, as it is said. And there is randomized control trial, other research trial, observational studies, and a variety of conditions to underpin the value of the evidence-based modern medicine. And that actually formed the methodological approach, which actually has revolutionized the healthcare industry and acceptance globally, and also penetration into the mainstream, so that in 90% of cases, people go to the modern medicine in the first go. Then comes the integrated approach. And the reason is that if you have acute problem here, heart attack, you're not going to be doing yoga or tai chi or qigong or taking some herbal medication. You need to go to hospital. But if it is a chronic condition, then there is no cure for many conditions, and taking the pills or pharmaceuticals for months and years can cause significant side effect and dependency in many conditions. And therefore, integration of both alternative and complementary medicine with the modern medicine can be beneficial. And there is growing interest in combining these, and that is across the globe. And the patients seek the holistic options without losing the benefits of the standard conventional treatment. There is global recognition of need for all this together, and the traditional medicines are now recognized in the World Health Organization. In fact, World Health Organization or WHO has set up a center in Jamnagar in India for doing more research and for setting how we can get these work together and have the scientific basis that support the complementary and alternative medicines, which can be effectively used along with the modern medicine for the benefit to the patient. Now, let's talk about the modern medicine's achievements and why it is so much valued across the globe. The first one is the diagnostic techniques, the revolutionary diagnostic techniques, diagnostic imaging, the molecular testing, even the traditional testing of the blood, which has evolved over years into the microarray, into other things which are really, really advancing in order to get the diagnosis more accurate, more precise, and more effective in order to pinch the precise condition with a confidence and at early stage. That actually has helped to save countless lives year on year. The second important thing where modern medicine excel is the evidence-based practice. And this is so important to help the clinical decision, which rely on a systematic research, evaluation, and a rigorous scientific standards of the treatment, which is across the globe. Paracetamol for fever is there, whether you go to United Kingdom, US, India, Philippines, Japan, anywhere. There might be slight difference in the name. Say, for example, acetaminophen is the name for paracetamol in US, while it's called paracetamol in India and UK. So it's the same compound and same effect across the globe. And therefore, using the medication is accepted across the globe, and that's a big advantage. The third big advantage is technological innovation. From robotic surgery to artificial intelligence in the diagnostic, and technological advancements has provided the precision in the treatment. And these newer techniques or innovations have improved the health outcomes across the medical specialties, whether it be general medicine, surgery, pediatrics, gynecology, ENT, dermatology, and all these where the advances have resulted into better diagnosis and better treatment. When we think of the evidence-based medicine, there has been evolution of the scientific methods of application, and these scientific evolution have been happening over several decades. Healthcare decisions initially were based on the thinking and converting the theoretical knowledge into practical knowledge by the doctors or physicians in early stage. But as the time advanced, there has been research, trial, systemic observation, and the treatment efficacy, which have resulted into the controlled studies to inform the physicians or medical practitioners about giving the evidence-based treatment. Subsequently, there started even next level, which is the systematic evaluation developed by the clinicians or doctors themselves as form of a framework, so that in one place what is the evidence-based decision is also an evidence-based decision in other part of the country or other part of the globe. These frameworks, as they evolved, become very popular, and the research hierarchies established a standardized evaluation protocols and standardized management protocols for a variety of conditions, including the cancers. And in cancers, standard evaluation protocols are a must. Then in 1990s, evidence-based medicine word has emerged, and that has become very popular, and that was formally established as a standard practice to be followed. And there was something called Cochrane collaboration, which was founded to synthesize the research findings together so as to give very strong evidence, and the level of evidence and the applicability is also through the group of scientists we can do research collaboration. Patient valued integration is what is now emerging, because modern evidence-based medicine combine the clinical expertise with the patient preferences. And this is where the patient choice lies, because we know that patient is the important part of the equation. They say no medicine for me without me, or my involvement is necessary for making the decision about treatment or management about me, because my condition may be different than person A or B for whom this treatment was trialed or designed. But I have a different personality, I have got different body composition, I have got a different family disease pattern, and I have got a different personal profile. And therefore, evolution has allowed more personalized treatment approaches, which is exactly the reason why we can give a better treatment. When we talk about the key strengths of modern medicine, we know that it has got precise diagnostics. So taking the point which we mentioned earlier, the biggest ones are MRI, CT scan, genetic testing, molecular diagnostic, etc., allow an unprecedented insight into the disease with a remarkable precision. And the conditions which are evolving themselves over the period of time are becoming more identified and more detectable, earlier detection, and with a remarkable accuracy that allows a precise treatment. The next part is pharmaceutical evolution, pharmaceutical innovation, and pharmaceutical advancement, which is happening over the years to allow life expectancy to become longer and longer through this effective drug treatment. The medicines now can target specifically particular organ, particular cells, and particular molecular pathways with a greater precision so that it is targeted therapy with less side effects. Then we mentioned earlier about the advancement in the surgical techniques. Minimal invasive techniques, which initially was in form of the laparoscopic surgery instead of open cut abdomen or joints, has been a remarkable change. And now you can have a micro laparoscopic incisions. Surgical outcomes, robotic surgery is becoming so precise and advanced. Recovery time is decreased with success rate increasing to allow better control of the patient, earlier discharge, and earlier mobilization with integration into a better quality of life at a very early stage. The other cornerstone, which is very visible, is about infection control and antibiotic invention. Right from the discovery of penicillin has been remarkable in changing the deaths due to the infections. Antibiotics are precise and are effective for sure. And I know that there is newer infections coming and therefore newer antibiotics are being discovered. But that is a very effective milestones of the modern medicine. The other complementary part is vaccination, which is preventive health condition for the infections. We know that eradication of smallpox has been possible just because of the vaccine, smallpox vaccine. Same is now with polio and many other conditions which are now en route to be eradicated. Public health measures prevent millions of deaths annually because of this, or even prevention of disability. And hence, we must give credit to the vaccination programs which are preventing not only the disability and death, but also improving the quality of life that happen due to the malady resulting from the disease, which are quite complex and difficult. Early screening program, I will probably mention yet about vaccination. There is controversy about the COVID vaccine, but whichever way we take, I think it has had significant contribution in limiting the disease spread across the globe because it was a pandemic. I'm not going to go into details because I know some people don't believe it and they think COVID vaccine has done more harm than benefit, but it's a matter of subjective judgment. I, however, would like to mention about the early screening, early detection, and early treatment has significantly reduced both the morbidity and mortality. And identification of risk factors and the health threats at a very early stage has been extremely powerful in bringing the results. Public health initiatives improving the population-wide outcome is other important thing that we need to think about. One second. Sorry about that. So let's think of the technological breakthroughs which have happened in modern medicine to make life a lot better, and what is happening now, even to make it more effective, more precise, and more um, attractive. So technological breakthroughs, particularly through artificial intelligence, and the artificial intelligence systems have made a massive advancement, and that is unmatchable both in terms of diagnostic accuracy and the specific treatment precision. Machine learning algorithms continue to improve with the exposure of wide data set of the clinical patient's disease and the disease management pattern, and it gives a feedback loop to improve the technology so that we can become more precise and reduce the work on the human uh, dependency, doctors, because we know there's shortage of doctors, but also sometimes artificial intelligence can pick up the data, disease or patterns, particularly in radiology and pathology, where constantly looking at computer or microscope can make a human being tired, but artificial intelligence pick it up precisely time after time after time, day or night, very accurately with the dependency and repeatability. So that's really good. Let's talk of the robotic surgery, where robotic systems have allowed or enabled unprecedented surgical precision, and you can do it from remote, which is fantastic because a person can develop expertise in one area but can't be everywhere. So remote technology, robotic surgery has allowed the complex procedure to become very effective with minimal invasiveness, and that is one big advantage of the modern medicine. Precision medicine is the other part because you can target the area, target the organ, target the cells, and genetic profile is now a guide for personalized treatment selection. This targeted approach maximizes the efficacy while minimizing the adverse effect because the genomic analysis and genetic profile, which is available now worldwide and has become available in just past couple of years, actually is changing the way we do that. And I am sure in next 4, 5, 10 years, there will be a precise personalized treatment for particular genomic profile. Next is digital health, availability of the health, monitoring of the health through precise remote devices to provide a perfect approach and management plan, and continuous care through the wearable technology is extremely good, effective, and powerful. The digital platforms enable better patient engagement as well as better self-management, but also remote management by the healthcare staff from the hospital, clinic, or other areas where an alarm can come if there is low blood sugar that needs coming. So patient can manage, but also if need be, below a critical level, it can send alarm to a healthcare professional at a remote area. Emergency and acute care excellence, as we mentioned, that emergency treatment and in acute care, there is no comparison of the modern medicine. And this is constantly advancing, and creating a better pathway. If you think of trauma survival improvement, there is 50% increase in survival rate since 2000. And that is because of easier access of the healthcare professionals to home, roadside, and in remote areas because of the access of the internet, ability to see what is happening in the area and reaching there faster through helicopter and other modes of transport, which are much faster. And I must say that in many countries, there is a separate road and priority for the ambulances and the healthcare staff. Second is advanced life support. There is standardization of the protocols and more sophisticated resuscitation protocol for emergencies, which are same delivered by doctors, nurse, healthcare professionals, or anybody else in the same way, so that it is more effective and is more precise and is more repeatable and deliverable to save the lives. And that is a big thing. Rapid intervention for time critical treatment pathways is the other thing which has happened, particularly neurosurgical conditions, cardiac conditions. There is time critical transfers, and there are time critical ambulances which are much faster, quicker, including air ambulances. That is actually changing the life expectancy significantly and preventing deaths. The other advantage is critical care advances and critical care illness cover for conditions that could have been life-threatening previously. Specialized intensive care and the plan in the systems and the developments with newer training of the healthcare staff is very powerful. Emergency medicine thus exemplifies the modern healthcare, life-saving potential, and life expectancy. In addition to the training through the acute scenarios and standardized protocols to provide the optimal healthcare delivery under the extreme pressure. And this is one of the big achievements of the current era of the modern medicine. Pharmaceutical innovations are happening all the time. And there is a lot of investment going into it so that we can have better treatment, better precision, better medications, and specific disease management through target therapies. And these targeted approaches reduce the system-wide side effects. And that is extremely good. Next is biological agents or biologic substances, which are protein-based treatment, which are more natural. They have revolutionized the autoimmune care. And these advanced medication modify the immune responses with unprecedented specificity and is extremely good for autoimmune disease like rheumatologic conditions like rheumatoid arthritis, inflammatory bowel disease, and many other conditions. Gene therapy is the other massive, big advancement in the modern medicine. And gene-based therapy for conditions, even like SCID or subacute combined deficiency, and many other inherited conditions where there is nothing, the gene from a person who carry that gene with a positive outcome to be implemented in person where that gene is missing actually, and the replication of this gene through a mechanism allow that person who had missing gene to incorporate that gene into the cell through the newer gene therapy technique. And this groundbreaking approach offer a potential cure for many genetic or inherited conditions. The last one is my favorite, which is personalized treatment regime, which is in evolution, is not as good as I would like it to be, but the medication protocol, which are now tailored to individual profiles, are quite useful based on their past effect, past treatment, and past response, also including pharmacogenomics and using the pharmacogenomic guide or genetic profile for optimizing the drug treatment, drug selection, drug dosing, avoiding side effects. So this is a fantastic achievement of the modern science. Let's now think of the evidence hierarchy. So the big studies which are most reliable to indicate us what should be optimal treatment protocol is based on meta-analysis and systematic reviews. And this is the highest quality of evidence synthesis that happens. The next one is randomized controlled trials, which basically mean there is blinded treatment and placebo arm. When the doctor or the physician doesn't know what is being given, is it placebo or the drug? The pharmacist doesn't know, the patient doesn't know. In fact, nobody is knowing apart from a small group of people who at the end have done this, and they are not in touch with the patient or they have no access, and therefore it is completely blinded. At the end of the research trial, they open the blinding, and therefore the group of the patients who got benefit now are tested whether they were having a placebo or the drug. And this is fantastic to give randomized controlled trial result treatment evaluation in a perfect way, and that's the gold standard for the treatment evaluation. Then the lower to that, a level of evidence is observational studies where there's cohort and case controlled research where people are aware of what is being done, but people try and observe because, say, for example, I will give example where there is, well, let me take it there. What is obvious blinding to the patient is impossible. Say, for example, yoga. If you're doing yoga, you can't blind the use of yoga with the medication. So observational studies are therefore very powerful still, although the evidence is weaker. Then there are case reports. So individual clinical observations by doctors or nurses or other people, and they report it in a scientific way, judge it scientific way, and that is a good evidence. Then is laboratory research, which is based on the foundational scientific investigations on animals or based on the Petri dish lab work based on the quantum physics and rest of the stuff, which is pure laboratory research. And this is all there. So if you think of, we need clinical expertise, we need patient values and circumstances or patient-based research, and we need the research evidence combined as evidence-based pharmacological treatment or evidence-based plan. Evidence quality therefore determine the decision or medical decision based on confidence, and this hierarchical approach is quite useful for a rigorous scientific standard treatment plan which can be implemented widespread across the globe. When we think of gaps in modern medicine, which is inevitable, no science is perfect. No man is perfect. No science is perfect. Modern medicine, in the same way, has been fantastic, as I mentioned earlier. However, there are still some gaps. There are some problems. There is no cure for every disease in modern medicine. There are several conditions without chronic, particularly without cure, particularly the chronic diseases, and there is lack of definitive treatment, including I would say chronic arthritis, dementia, Alzheimer's disease, Parkinson's disease. Even for diabetes, you have to take the treatment lifelong. There is no cure. For asthma, you keep taking the inhalers so as to suppress the symptoms. So therefore, there is no complete resolution of the disease condition itself. And therefore, taking the medication for whole life may not be a preferred treatment or preferred mode for many patients. Second one is treatment side effects. So powerful interventions often carry significant adverse effects. And majority of drugs are not without side effects. If you read the side effect profile, if you buy even simple thing like paracetamol, you would be alarmed. Therefore, the risk-benefit analysis is important and remain challenging, particularly for the complex, difficult medicines newer medicines and also for those which do not have a very favorable side effect profile. Next, we are going to touch about the chronic disease challenges. So long-term conditions require complex management strategy, particularly because their lifestyle is already limited, and adding the complexity of the disease side effects as well as the medication side effects can cause a significant challenge or problem for the patient, particularly when we take the quality of life consideration and this extend beyond the symptom control. When I go to the complementary and alternative medicine seminars or conferences, they often say modern medicine is more focused on symptom control rather than eradication of the disease. Whether it's true or not, I will leave it for audience to think because individual thoughts are different. What I'm suggesting is it's good to think and be open about it. The other important consideration, particularly with the patients, unlike UK where the healthcare is completely free to the point of delivery, cost barriers exist and they prevent the optimal care for many patients, and the socio-economic factors coming, traveling, and access to the doctor, waiting lists, etc., have significant impact on the treatment availability, and more so that patient choice becomes very limited. Let's take advantage of the chronic pain management. We can find that there is inadequate relief, which is the big purple part of the circle, and that is a significant challenge. Medication side effect is that blue part, which happens in a good proportion because of non-steroidal anti-inflammatory agent like um, diclofenac, indomethacin, E1 paracetamol, and the ibuprofen can be quite risky for the kidneys on long-term use. Dependency concerns are there, particularly that's the green part of the circle, which is due to the opioid or morphine or codeine or these things which act on the brain, and that include pregabalin and the gabapentin. The dark green is access to the specialist, which again become limited as you become more and more specialized to the pain consultation or pain consultants. It become that, and cost barriers which are in the yellow are other problems, and that is very well. And 20% of the UK pain, well, adults suffer or have suffered from the problems due to long-term medication, and this is really difficult. If you think of the autoimmune conditions, that is actually quite significant chunk, and it is increasing every year. Almost 9% increase every year, and a significant people suffer from the autoimmune conditions, whether it is the arthritis or it is the autoimmune bowel disease, autoimmune thyroiditis, autoimmune brain conditions, spine, skin conditions. They all can be a significant challenge and a problem. And this can cause significant problem. There are more than 80 conditions which are autoimmune diseases, and they affect a variety of body systems. And this is more prevalent in females with 70%, no, instead of 50-50, 70%. Females predominance due to various other parts which we don't have time to talk about. They have got this problem, and these autoimmune conditions cost 18 billion annually onto the health sector. It is important that the conventional treatment, which is focusing currently on the symptom management, may have failure in addressing the underlying cause completely. Immunosuppressants are very good to control it, but they can have significant side effect profile, and it cause significant effect on the quality of life of the patient and their families. Mental health condition is the other group of condition where there is treatment gap. There is limited understanding of the neurobiological precise mechanism that has caused into mental health problems, and their manifestation, and a good proportion may not have any anatomical or structural defect. Therefore, your MRI, CT scan, or even EEG and rest of the investigation do not show any problem. And although there are some standard protocols developed, the real mechanism is very difficult to understand, and that's why the antidepressant of variety do not help all the patients of depression. Other important part is variable response, because the medication efficacy average only 60 to 70%. Remaining 30 to 40% do not get benefit from the same medications. Other thing is, what is proven in the animal experiment or even human experiments may not be effective in all. Particularly, people have different genetic profile, people have different personality profile, people have different biological structural profile of the cells, and these all have pathophysiological difference, and therefore the same medication is not effective in all. Other thing is also about delayed effect. So the drug side effects may take weeks or months to show up. And the same thing is, many of the drugs, even for their normal response, may take very long time. And patients may not be willing to wait for that long, particularly in the mental health conditions, while other things may be like yoga, meditation, hypnotherapy might bring the effect much quicker with practically no side effects. There is other part which is the access barriers. The mental health specialists or psychiatrists or mental health worker even are in shortage across the world. And due to limited availability, the condition worsen. The mental health condition continue to worsen, and therefore patients seek or access becomes a barrier, and patient receive the treatment or the ideal management much later while the condition has become worse, and therefore it's uphill task or much more difficult task. And this is the reason why we have increasing conditions, mental health burden in the UK, and holistic approaches can be very good, and they are increasingly being recognized as essential for a comprehensive care. So whether we give the treatment or not, these can be started early on because they don't really have much of the side effects, can be practiced at home. And when the medication starts, hopefully the need for medication will reduce. Then we think about the stress-related disorders, PTSD, the post-traumatic disorder, or even the physiological impact of the work-related stress or family-related stress can be quite devastating. And the cortisol, which affect the multiple body systems simultaneously, the chronic elevation of the cortisol lead to wide hepatic stress, and the effects of this stress and the raised cortisol on a variety of tissues and increased risk of infection and dysregulation is quite effective, and that can cause cardiovascular stress with high blood pressure, immune suppression, and the metabolic disruption, and that's quite significant. Pharmaceutical options are very limited. The pills are not the cure for everything, particularly for stress. Symptom management predominate without resolving the actual underlying issues, and therefore mind-body interventions like mindfulness, yoga, tai chi, qigong, etc., or heartfulness, mindfulness are quite useful adjunct to the treatment as integrated treatment approach addressing both psychological and physical aspects. Stress-related disorder can cost a lot. In the UK, 12.8 billion is the cost of the treatment of the stress-related disorder, directly or indirectly in form of the treatment, in form of the extra facilities, in form of the loss of work, effect on the family, the direct and indirect expenses, and that's a huge amount. And preventive approaches, particularly as I mentioned, yoga, Ayurveda, meditation, etc., and heartfulness, mindfulness can contribute significant potential saving across multiple sectors and also improve the quality of life both for patient and the families much earlier rather than waiting for drug treatment. The other big group is the degenerative condition for which there is no cure in the modern medicine. Degenerative neurological condition, in fact, affect around 1 million patients in the UK. Alzheimer's disease alone impact 850,000 plus individuals with limited disease modifying treatment available. Therefore, we know that the current approaches primarily manage symptom without significantly alternating and changing the disease progression. And that is whether it is dementia, Alzheimer's disease, Parkinson's disease, and many other conditions. The other big group is functional disorders. And when we take some examples like irritable bowel syndrome or IBS, commonly called, affect 15% of UK population and probably similar in most developing countries and developed countries. The conventional treatment show limited efficacy or ability to control the symptoms unless there are significant risk of side effects. Quality of life impact the patients far beyond the physical symptoms, because going into the work, visiting toilet frequently, stressed, just going to friends and relatives or guests or places might be inhibitive factor for them, and it can cause significant stress which exacerbate the symptoms of irritable bowel syndrome. It's a catch-22 situation. Fibromyalgia is another undefined condition, and it presents significant diagnostic and treatment challenges because all the tests are normal, but the patient is suffering, and at times a group of doctors do not even believe this is a medical condition. While patient is having severe significant pain all over, there is brain fog, there is a significant impact on the quality of life, and that is associated with widespread weakness which causes family problems, because say for example mother is not able to cook the food, is bedridden, lying in the pain, children having difficulty, husband having difficulty, they themselves can't go to the work, and this all is a multiple body system problem which are simultaneously affected, and there is no physical illness or physical defect found in the body, as all tests are normal, and therefore an approach to this through alternative and complementary way could be helpful. I'm not saying it's going to be helpful in all, but it's worth thinking about. Chronic fatigue syndrome is other similar condition where there is no pain, but there is significant weakness to all muscular body systems. And this is a complex condition because there is very limited biomedical explanation or abnormality in the test, and the current treatment offer very little benefit apart from physiotherapy for most patients. And although there are some um treatment regimes available, multifactorial nature suggests that there is much better outcome using the holistic integrated approach, including the yoga, Ayurveda, hypnotherapy, Tai Chi, Qigong, and many, many other conditions, including the music therapy, dance therapy, for that divert the mind and bring a better effect. Let's think of the limitation of the pharmaceutical approaches or drug treatment. There is no pill for every ill, and that's mentioned many, many years ago. Adverse reactions to the drug cause 1.9 million hospital days annually in the United Kingdom. The side effect profile of the drugs significantly impact the quality of life of many patients and their families. And therefore, if we can reduce the need for it using alternative and complementary approaches, it might be a beneficial thing for patients and for the nation. And that includes the cost burden reduction. The other thing is polypharmacy risk. So multiple medications, something used for pain, for example, fibromyalgia, something for weakness, something for brain, something for other conditions. So some of these patients have complex multi-system disorder, and therefore, for lung, there is other thing used for infection treatment in form of antibiotics. For viral treatment, something else. Other body organs may need that. Drug treatment for anemia, osteoporosis, arthritis, and dementia is very common in the old age. And this polypharmacy can cause complex interaction of the patterns and complex interaction of the drugs, leading to even worse situation, particularly in the aging population, which face the increasing risk of the drug interaction due to drug combinations. Symptomatic treatment is quite useful when person is suffering, and many medication address the symptoms without affecting the underlying cause, and that's typical of the modern medicine. However, the long-term use of this symptomatic treatment, say for example for chronic pain, use of painkiller for years can be a significant problem and not only mask the progressive condition without modifying the disease, but also cause significant side effect and organ damage, which may not be recognized for a period of time. Drug resistance development, particularly with the antibiotic and antiviral drugs, threaten the treatment efficacy. Therefore, pharmaceutical treatment should be limited, and pharmaceutical development pipeline is now struggling to keep pace with the emerging resistance with MRSA, the methicillin-resistant Staphylococcus aureus, the Clostridium difficile, and many other drug-resistant strains are now coming up, which is causing a significant strain on the health burden, health system, and health practitioners. Other thing to think about treatment of drug resistant condition or treatment resistant conditions, for example, depression. There is no treatment for all patients with depression. Epilepsy, drug resistant epilepsy is existing and in fact increasing. Chronic pain, as we talked, there is no response to all variety, whether you use non-steroidal anti-inflammatory, opioids, codeine, paracetamol, ibuprofen, um, gabapentin, pregabalin, and many, many other conditions. Any drugs used still are not effective for all patients of the chronic pain. rheumatoid arthritis doesn't get control, although rituximab and many newer biologics and agents are more effective and have improved the quality of life of patients with rheumatoid arthritis, but still something like somewhere 25 to 30% patients are still having no benefit. Asthma, again, as long as you take the treatment, they get benefit, but the proportion of patients, something around 15%, despite using all the medications, do not get full relief. Now, talking about all that, the limitations of the modern medicine, despite being fantastic and all pervasive, beneficial to the patients, there are limitations and gaps in the modern medicine. And there's a question, can we use complementary and alternative medicine to fill these gaps in the modern medicine? So one aspect is mind-body practices, meditation, yoga, tai chi, guided imagery, meditation, heartfulness, mindfulness. All these are mind-body practices, including neuro-linguistic programming, hypnotherapy. They do not cause any direct effect on the body organs in terms of the adverse effect, and all they have got is benefit, positive outcome. Although it may not be beneficial in all, whatever 10, 15, 20, 30, 40, 60, 70 patient, or sorry, 70% patients, whichever proportion of patient or percentage of patient is benefit, it is useful. On the other hand, there are some manipulative approaches which do not involve taking the drug into the body, that include massage, osteopathy, chiropractic, reflexology. These all are again harmless because they are just manipulation of the body, massage of the tissues to release, relax the spasm of the muscles, and manipulation of the joint stress or a slight degree of angulation of the positioning or stretch of the ligaments, etc., can be repositioned through these external techniques, and these manipulative techniques can be beneficial with no side effects, particularly in chronic pain, chronic backache, in stress, in strain, joint ligamental injury, or even milder degree of subluxations. It can be beneficial just fixing it back, relocating into the proper position to reduce the joint swelling, and repositioning can reduce the pain. And this is beneficial even if putting a plaster cast, because in plaster casts, repositioning is still take long time, particularly with minor subluxation, while this can be repositioned very quickly, and then manipulation can be beneficial. Obviously, you need to contact a qualified health practitioner rather than anybody. Therefore, people who are qualified can provide the relief with minimal or negligible risk. The next level, we can talk about traditional system, and then we can talk about Ayurveda or herbal plant-based treatment, traditional Chinese medicine, or naturopathy. And these are all traditional system, traditional Indian medicine system, traditional Chinese medicine system, TMS or IMS as they are called. They have been there for thousands of years and have been saving lives. They do not have as strong evidence to prove, but patients get benefit, particularly in chronic diseases. And therefore, it's worth thinking whether we can use these in chronic conditions for patient benefit. Then we have some other natural product therapies like nutritional supplements, aromatherapy, art therapy, music therapy, dance therapy, herbal medications, etc., which can heal the body in a more natural way. And this complementary and alternative holistic therapy or therapeutic approach outside conventional medicine is more acceptable to the patient in majority of the cases, particularly the chronic conditions. And the research is increasingly showing the evidence, evaluating the efficacy and integration possibilities are being included in the standard care plan, particularly where there is a patient choice involved in the delivering system, particularly privatized healthcare where patient has got a say in what treatment they receive and they prefer the integrated or holistic treatment rather than pure pharmaceutical drug treatment, which can have significant side effects. When we talk about the modern care, when we talk about intellectualized care, when we talk about universal care, when we talk about people who are patient-centric, we must think that it need to think involving not only one system of medicine, but also involving other things. And when we talk of the complementary or alternative medicine, it's good to understand what is complementary medicine and what is alternative medicine. So complementary medicine or complementary therapies work alongside conventional or modern medicine, while alternative approach or alternative medicine replaces the standard treatment entirely. And that's why it's called alternative. Integrated, therefore, is not excluding or alternative that include the modern medicine and working along with the complementary and alternative medicine, where patient can get the benefit of all with a careful planning so that there is no interaction. And this is much better. And this distinction of integration rather than replacement of the evidence-based conventional care can be very powerful in the modern life. Other thing worth thinking about is the global usage and global pattern of uses, insurance-based treatment, the conventional treatment, traditional treatment. All these have significant difference country to country, city to city, remote, rural area versus city area, urban area. And the prevalence of the disease or the conditions vary widely from region to demographic person. And therefore, higher education level and awareness about these complementary and alternative medicine use with the risks involved with the use of complementary and alternative medicine is extremely important. And there is a word of caution, always take advice of a qualified health practitioner, because using any of these can produce a significant risk. I must say that cultural factors play a significant role and significant influence on the specific therapy preferences. And that is where the regional approach and a combination holistic approach is quite useful. We must not forego the oversight of the evidence-based approach or evidence-based continuing. Research quality needs to improve and implement onto the practice. And we know that research quality varies substantially across different modalities, particularly weaker evidence with the complementary and alternative medicines. Particularly, say, for example, you want to do a cross-control trial. You can't do a blind trial for yoga or Tai Chi or Qigong because patient knows what they're doing. And therefore, blinding from the patient point of view is impossible. We can use hybrid model where we can use yoga, tai chi or qigong or meditation or anything alongside the conventional medicine. So one arm is using only conventional medicine, the other are using conventional medicine with these adjunct complementary medicine, and we can see the difference in the groups. Some approaches thus can build a more robust evidence, while if some studies where there is pure observation without any blinding, the research evidence become weak. Therefore, scientific evaluation and the methods of evaluation needs to be calculated, advanced, and expand so that we can have a true evaluation of these promising therapies from the complementary and alternative medicine as adjunct to the modern medicine. So let's think about the traditional medicine systems. World Health Organization now has acknowledged the traditional medicine's significant contribution, and that is globally recognized now. Many systems now represent the cultural emphasis, cultural heritage, or cultural nuance to the modern medicine with centuries of empirical refinement. As I mentioned, Ayurveda has been existing for nearly 5,000 years. Chinese medicine, traditional Chinese medicine is existing for a few thousand years, 2,000-3,000 years. So all these have been providing benefit to the humankind. And that is an empirical approach, but they lack that scientific rigor. But that does not mean they are less of a healthcare system, and therefore WHO is now putting emphasis on to combining these and giving value to this. Other thing is the historical context, which is the long established system evolved over a period of time, particularly the traditional system, and that approach needs to be combined with the modern scientific methods. And there is a role to be played by the newer generation, millennial generation, to combine this for a better patient care. One thing very important to pay attention to is the plant-based medicine, which form the foundation of many traditional medicine systems or traditions. And this is particularly called ethnopharmacology. So it's a pharmacology, but it's plant-based medicine. Modern research is increasingly validating the scientific principles in these herbs or traditional herbal medicines. And I have been involved in some of the research, and we found that active principle, for example, in shalaki, which is a plant it's called, has got boswellic acid or Boswellia serrata, and that is 5-lipoxygenase inhibitor. And that is exactly what infliximab and many biological agents achieve. So 500 pounds versus 5 pounds, achieving the same underlying mechanism of 5-lipoxygenase inhibition. That is the scientific research which I'm alluding to and I'm emphasizing and I'm promoting. I'm promoting always evidence-based approach and a better scientific evaluation before jumping on to take the therapy treatment. I am therefore keen on setting holistic frameworks so that the traditional system typically view the health as whole person approach or whole person balance and unite it with the conventional medicine so that these conceptual models address the physical, mental, and social, spiritual dimensions simultaneously and give the benefit to the person rather than to organ or to disease. Disease is where the organ has departed, but then setting up, it has got its physical, mental, spiritual effects and emotional effects. And these all need to be treated because WHO has defined that disease is not just absence of physical symptoms. It is a complete health is a physical, mental, emotional, social well-being. And that's what health is. And let's try and bring everything together to cause benefit to the patient as a whole through holistic approach. When we talk of the mind-body interventions, there are some neurobiological effects, and meditation, mindfulness, or silent retreat have measurable changes in the brain, both the structure and the functional through the functional MRI and through the EEG and through the PET, positron emission tomography, and many other functional scans, but also a direct change feeling of the patient. Regular practice affect areas which are controlling the attention, emotion, and stress response. That is very scientifically proven. The second is physiological impacts of the mind-body intervention. Yoga demonstrates physiological measurable effect on multiple physiological parameters like heart rate variability, blood pressure, and body functions. The benefit improves the improved flexibility, muscle strength, and cardiovascular functions, as well as ability to control stress and regulate the stress. Regular yoga and meditation reduce the stress in 30% of the patients. Clinical application of the mindful based stress reduction or MBSR shows evidence for multiple conditions, and the MBSR protocols now feature in numerous clinical guidelines. And many of big corporate world is using the mindful based stress reduction to increase the productiveness in the workplace. Nutritional and herbal medications or plant-based medication or phytochemical medication are now being increasingly recognized and increasingly used because there is advancement in the analytical methods to identify the active principles or active plant compounds and why they are effective. And I have done work on identifying the scientific principles, the scientific mechanisms, the biochemical principles, the biophysiological principle of mechanism of action of these plant-based herbal medicines and nutritional principles, which increasingly are now being understood through the molecular research. And I have got a separate talk on how the biochemical, molecular, and the um, biophysiological effects of these plant-based medication are more gentle on the body with minimal side effects and much more effective physical and physiological effects on the organs and organ systems, removing the disease pattern and improving the symptoms. The other additional part is increasing pharmacological understanding through the pharmacokinetics and pharmacodynamics from these plant-based medication inform the clinical application of these phytochemical substances particularly now compared to past, we understand these herbal medications or plant-based products, how they're absorbed, their absorption, their distribution, their metabolism and excretion is now much clearer to the studies, and that is now guiding the appropriate dosing with minimal side effects. The other important part I mentioned quite early on was the interaction awareness. The drug herb interaction, herb to herb interaction is now more widely known. There is in the US a pharmacopoeia that can connect and tell you and inform you about these drug herb interaction. And the research of the drug herb interaction has improved the safety profile. And this knowledge has been tremendously helpful in preventing adverse effects because of appropriate prescribing, appropriate knowledge, and informing the physicians what to avoid and what not to avoid, and informing patients about how to maximize the result with minimal side effects. Clinical evidence-based development of the pharmaceutical drug products compared to herbal preparation is very high. However, there are randomized trials being done to evaluate the herbal preparations, and evidence is being built, which is now I find there are journals of phytochemistry, there are journals of herbal medicines, there are even in PubMed there are lots and lots of articles on a variety of herbal treatment for particular disease conditions, and that is improving the research base and the research with methodologies and informing us which plant-based products are more effective in what conditions and in particular relation to the body composition, which is missing in the modern medicine. When we talk of the manual and physical therapies like chiropractic, osteopathy, massage, etc., there are now modern research methods being used, and they reveal physiological mechanisms behind the traditional manual therapies. And neuroimaging demonstrate that acupressure and acupuncture, osteopathy, and chiropractic has got effect on the brain activity pattern. There is a lot more research on acupuncture, which is a highly specific manual and physical therapy. And acupuncture is now involved in recommendation even for NICE guidelines for chronic pain and some other conditions. I have used acupuncture myself when I had the sciatica with compression of disc onto my nerve, and I found the benefit. I've used acupuncture, I've used cup therapy, I've used osteopathy, I've used chiropractic, I have used massage, and I've used the herbal treatment in form of super nerve power, which has ginkgo biloba, which readjusts the neurotransmitters, which is causing constant severe pain, while the effect is not being achieved by the opioids, codeine, and gabapentin or pregabalin. So these things are cupping therapy. These all help. They are adjuncts. And therefore, I'm not saying stop the medication. Continue to use, but use other things so that your use of the pharmaceutical drugs can be reduced or minimized. Also, there is a touch therapy, which is consistently activating the parasympathetic response. And we know that reduce the stress hormone production and the inflammatory markers. And touch therapy is reducing the pain mother's touch onto the child or to anybody. In fact, and touch therapy in a sympathetic way. And this is basis of many energy-based therapies like Reiki and other energy-based therapy is reducing the pain. It could be a placebo effect, but it does bring the effect. And there is proven physiological reduction in the blood pressure and reduction in the heart rate variability through these. As we mentioned, energy medicine or energy-based therapy, there is a lot of research being done on it, and biofield conceptual models are now proven to bring the effect. And there are theoretical framework which describe the electromagnetic interaction in the living systems, but these are becoming more and more practical now. I have found that there is an energy therapy rod which changes the magnetic field. And these models attempt to explain observed clinical phenomena through the measurable mechanisms that explain the scientific basis of these electromagnetic or biofield concepts. The bioelectromagnetic mechanism or phenomena is very well known in human bodies for many, many years. And human bodies generate a major electromagnetic field. We know that the effect on the heart and brain and muscle activity is very apparent when we use this bioelectromagnetic field and the signal manipulation of these through the energy therapy, through biomagnetic therapy, through the magnetotherapy, through the electrotherapy, through energy